Hello, I'm Dr. Shrigada. I'm a consultant pediatrician in Oxford. Today, I'm going to talk on the topic of anxiety in children with neurodevelopmental disorders. Every single one of us has suffered from anxiety and worry. After all, these are evolutionary survival responses. However, when these worries and fears become persistent or distressing, or when these worries and fears start affecting the functioning of the child, then that's a problem that needs addressing. Anxiety is a common problem. The Royal College estimates that up to 300,000 children in UK alone have an anxiety disorder. But this is far more commoner in children with neurodevelopmental disorders such as autism and ADHD. There are different types of anxiety disorders such as separation anxiety, social anxiety, general anxiety disorder, and specific phobias. Generally, the more severe the anxiety disorder, the greater the impairment in functioning, and consequently, the longer this problem of anxiety is likely to last. Which neurodevelopmental disorders does anxiety frequently accompany with? Anxiety is commonly present with conditions such as an autism spectrum disorder, a ADHD or attention deficit hyperactivity disorder, a developmental coordination disorder or dyspraxia, and anxiety can also accompany a sensory processing disorder, that is, disorders or conditions in which a child has difficulty in processing sensations of smell, sight, sound, taste, or texture. What are the signs and symptoms of an anxiety disorder? The signs and symptoms of anxiety disorders can be conveniently categorized into two. In the first category, the signs and symptoms are the ones that are present in any child or adult, such as difficulty in concentrating, the child being irritable, restless, or fidgety, the child having symptoms such as headache, pain in the chest, or stomach ache, child having frequent visits to the toilets because of bowel or bladder issues, the child feeling breathless or breathing fast but shallow, the child feeling sick or nauseous. And children with anxiety can also have difficulties falling asleep. They could have educational difficulties and poor school attendance. They could have behavioral issues and be argumentative, or they could lose interest in play and leisure activities. In children with neurodevelopmental disorders, in addition to the generic anxiety symptoms above, I also tend to see in my practice a worsening of their underlying neurodevelopmental disorder. In a child with anxiety, the child could also have worsening of their socialization difficulties, an exacerbation of their communication difficulties, and anxiety can have impact on their attention abilities and also worsen their coordination abilities. Why is it important to address anxiety early on? It's important to address anxiety early on because it can worsen the child's underlying neurodevelopmental condition. And apart from this, it can have other negative unintended consequences, such as a child can have low self-esteem, develop low confidence, they can underachieve in leisure, sports, they can underachieve in education and learning. It can have an impact on their ability to form friendships. It can destabilize families' functioning. Apart from this, anxiety can also increase the risk of depression, self-harm, and probably substance abuse in future. What should you do if you're worried about anxiety in your child? I shall cover this topic in my next video. Meanwhile, if you wish to know more about anxiety or the management of anxiety, then you can read my article on my website or on my Facebook page. Thank you for listening.